Thank you very much. And let me start by thanking the organizers for the invitation. It's always a great privilege to be able to leave the Eiffel Tower and meet the real people and bring our research into debate with the ones that it's meant for. I have very little time, so I'm going to spend very little time on the formalities and a lot on trying to explain both the workings of the Nordic welfare model and of how Denmark used the welfare state to try and get through the crisis. The first slide indicates that basically there's nothing different to what happened in Denmark than happened elsewhere with the crisis. It's the same symptoms. The banks took a hard hit. You could not trade your house in the housing market. There was no activity in the housing market. And the consequence, as we saw it everywhere else, was a very high increase in unemployment. So that's the picture that we see in Denmark, in the other Scandinavian countries, and Baltic countries, unfortunately across the globe. Yet, I put down here on the bottom that Denmark was, as I put it here, very well prepared and very robust to meet the crisis. I'm giving you some of the examples of why we were quite well prepared, because the Scandinavian welfare system, at least as we've implemented it in Denmark, but also in the other Scandinavian countries, is not a static thing. This is a list of reforms that the Danish Parliament had introduced to the Danish welfare system for the last 15 years. So you can see, nearly every year, we have a commission coming in, or we have the Parliament setting down a commission. Could you please look into this? Give us some pointers of how we're going. It's not always so that the Parliament follows the advice that they get from the committees, but they sometimes do. So it's a very dynamic model that all the time is being remade. The robustness, I think, comes from a very long history. And entering a relatively new republic as Latvia, I think the first thing we would say to Latvians is that things take time. That's the first message. It's not a maybe very encouraging message, but it's a very important message. Things take time. Okay, you probably all are familiar with the highlights of the Scandinavian model. I'm just very briefly running over here with it with you. So, the Scandinavian welfare regime is about universal, and therefore it's expected to be expensive because we give to everyone. It's in the main tax finance. This is a very Danish way of looking upon it. My Norwegian and Swedish and Finnish colleagues would say we have lots of contributions in our systems, but there's still contributions that are set by the Parliament. So it's a politically decided system of contributions and taxes. We emphasize public provision, that welfare is a public thing, and the way the citizens meet welfare is in the form of a public social worker usually, or a transfer payment from the state or the municipality. We would like to boast when we travel outside that we provide very good quality services. This is debatable, and there have been some scandals within healthcare and elderly care that kind of shows the opposite. And it is also expected to be quite egalitarian because that we have quite flat rates, like opposite of Latvia, that you cannot get a lot of money in child support if you're wealthy in Denmark. And all this, and this is perhaps the most important comment at this point, it's all based on an idea that everyone's working. Everyone's in the labor market. Everyone's in the formal labor market. It's not very strange that men are in the formal labor market. That happens everywhere. So the big thing that maybe characterizes Scandinavia, or makes Scandinavia stand out, is a very high rate of female employment. Women are working, but also young people are working. We try to have people not retiring too early. So a high degree of participation in the workforce is a very important precondition for the Scandinavian model. Now, I don't want to be here all alone, so I brought a Swedish colleague with me, Joachim Palme, and he's supporting what I'm saying. He says the Nordic model is about universalism, generous benefits, social citizenship rights, dual learner model, active labor market policies, and extensive social services. And if you don't trust us, I brought an American colleague who says the same thing, but I do think you trust me. Now, so what happened with the crisis? Well, as I said just in the beginning, the crisis superficially wasn't any different in Scandinavia as elsewhere. But I think the reaction in Scandinavia was somewhat different. Maybe, first of all, I should mention that in this presentation, I make a lot of generalizations. I talk about Scandinavia in the single. I talk about the Nordic model. All these are abstractions. As you probably know, as you do know, there are vast differences among the Scandinavian countries. One difference is that Norway stands out. We have representatives from Norway here, so I shouldn't spend a lot of time on Norway, but I just mentioned to you as a curiosity, when I prepared writing a scientific paper on which this presentation is based, I contacted a Norwegian colleague. I wrote to him and said, so Ivar, could you please send me some articles on the crisis in Norway? A few hours passed, I got a reply from Ivar. He said, what crisis? The Norwegian understanding was that the crisis is something that's going on elsewhere. You know, it's maybe down there in Europe or over there in the United States, or something, but it's not in Norway. But we were, apart from Norway, Scandinavian countries were quite hard hit by the crisis. This is a chart showing you the unemployment rate, and I think the unemployment rate is the best indicator of to what extent there is a social crisis in a country or not. And what you can see here, and again, I don't have a lot of time, but you can see, if you look carefully, you can see that most of the Scandinavian countries were among the countries, the few countries in Europe, that were able to maintain some degree of full employment for quite a long time. Denmark is the exception. Denmark was very hard hit by the First World Crisis in the mid-1970s. And as you can see, Denmark had quite high unemployment rates from the mid-70s and onwards, but not in Sweden, not in Norway, not in Finland. It wasn't until the 90s crisis that Finland and Sweden went into crisis. And what you can see that the Finns, we have colleagues from Finland that can correct me if I'm not right, but I think I am correct, saying that Finland, at least from an unemployment point of view, really didn't get out of the earlier crisis when this crisis hit us. So Scandinavia is certainly not an area that are crisis-free. On the contrary, we have quite high rates, as you can see, of unemployment, except, as I said, for Norway. This is the same thing illustrated. I'll just give you this idea that if we say that 5%, under 5% is relatively low unemployment and over 5% is relatively high unemployment, you can see that, again, with the exception of Norway, we're not doing very well. I've said that we have seen uneven developments, but we have seen in all of the Nordic countries, unfortunately, like we've seen in Latvia, we've seen an increase in inequality and poverty. Quite substantial increase from statistically seen. But as I put down here at the bottom, the initial levels for inequality and poverty were very low in Scandinavia. So even if the increase was quite sharp, it was from very low levels. The European Union has now taken up the habit of calculating what it calls risk of poverty. It's calculated as a 60% cutoff line. It's those families or those households whose income are less than 60% of the median income in the country. It's been debated whether this is a poverty line, but at least it does indicate families that are at the margins of poverty. And you can see that generally Scandinavian countries have lower incidences than Europe in general. And you can also see that at least in Denmark there has been an increase, while Sweden, Norway has been able to maintain the same level. This is what most people say is the issue here. How can we bring back growth to the region? And if you take the right-hand column, these are of course estimates. 2012 is not over yet, but they're very fragile figures. Very fragile figures. I say in one perspective you can say that the Scandinavian countries from a purely financial point of view are out of the crisis. From a social point of view, we're definitely not out of the crisis. I'm sorry, this is not very easy to read. What I wanted to indicate to you here is the middle column, which indicates the total social expenditure as share of the GDP among the Nordic countries. And interestingly, I think what you see during the crisis year is an increase in social expenditure. And I think this is one of the areas, this is one of where Scandinavia stands out from the reaction in a number of OECD countries, that across the board in the Scandinavian countries, governments have used the crisis, you may say, as an excuse to boost the social sector. So that we have said, yes, we have a crisis, that's very bad, but we're not going to respond to the crisis by drawing back the state. On the contrary, we are going to try and ensure that the crisis will be softer on people through state intervention. So we have behaved very kind of traditionally Keynesian in Scandinavia on this crisis, and not very neoliberal. The figures I gave you before showed an increase in social expenditure vis-a-vis GDP, but as I just shown you on the other slide, that the denominator hasn't been doing very well. 2 minutes? Okay. So it's also fair to show the absolute increases, because you get the percentage increases because of low growth, but we have really spent more money on each person in the country. Now, I just want to give you this slide because it's, I think, familiar to what you've seen in Latvia. This indicates where we spend the money from the welfare state. And the bottom line is social assistance. 3% of total social expenditure goes directly to the poor. So the Scandinavian, in this case, the Danish welfare state, is about the whole population. It's not about poor. It's about the whole population. I think that is very important to say. As I mentioned, it's premised on everybody working. And I'm not coming to one of the issues that I think has an interest here. It's the fertility rate. This is a chart of the number of children that a Danish woman would have during her lifetime from 1901 till today. And I'm not going to advocate war, but war is good for fertility. So you can see First World War, you can see Second World War. But more importantly, you can see a reverse of the trend of declining fertility rates. From 1901 till 1984, Danish women have fewer children. What happened from the mid-1980s and onwards? Expansion of the welfare state services towards families with children and older people. If you create a comprehensive welfare state, women are able both to go to the labor market and maintain responsibility for children. 1 minute. What did we do in Denmark? We spent more money than we had. We maintained a tax system. We gave tax breaks to the rich. And we did a number of initiatives that could help the municipalities improve work around housings and institutions, all created a better employment situation. What's the conclusion? Well, very, very briefly. You can send a little mermaid to Shanghai. She was there for a while. And you can export Lego bricks. The problem is, and you can also export architecture. Social welfare is a different thing. You cannot easily and directly take elements from a social state and take over to another, because there are important preconditions for what happened in Scandinavia. There's a very long tradition for consensual policy. There's a very long tradition for seeking compromise. There's a very long tradition for a parliamentary system with political parties with a very long history. And without those preconditions, you cannot just import what we have produced. Thank you very much for your attention.